Thank you, ma'am.
Thank you for giving me this opportunity. Am I audible clearly?
Yes, ma'am, you are audible.
Yeah, thank you.
Thank you.
Yes. Yeah, today's topic it's about understanding the concept of dyslipidemia and Ayurveda. Very good evening to one and all who has joined this webinar and whole the team Fire Drushti. Good evening to you all and thank you for this sessions which is giving us immense knowledge. With this, I want to start my presentation. The topic, as you all know, understanding the concept of dyslipidemia in Ayurveda. These are the contents of the paper. Yes, we all know a long, healthy life has been the cherished wish of a man since ages. Today, also, it's the same. But because of the increased sedentary lifestyle, our fast life, alteration in food habits, because of increased social competition and global economical growth, these all leading to the metabolic derangement nowadays. The first and foremost condition which comes in this is about the dyslipidemia. Yeah, this is nothing but there is change in lipid levels, which is the major risk factor for other disorders, main diseases like ischemic heart disease. It's not only ischemic heart disease, completely the cardiovascular events are major risk factor is this. And another thing, hypertension, diabetes mellitus, day to day we are seeing this. Yes. Another thing is globally one third of the incidence of ischemic heart disease it is attributing by dyslipidemia only. Clear? In Ayurveda, with this conditions falls under the category of Santharpanota Vization of Kapha dosha, Rasa and Medho Dhatu. Clear? Yes. Coming to the Chikitsa in dyslipidemia, mainly as it is a clinical condition and derangement of lipid levels, which is the rooted from the physiology. Here, the line of treatment should aims at accelerated, appropriated nutrition that will be leading to the improvement of the biological competence. So, we need whenever we are treating the dyslipidemia, we need to concentrate more on the correct or we are bringing back of that of the physiological aspects or whatever the physiological metabolism goes that we have to bring back. That is the main aim of chikitsa in dyslipidemia. Clear? Yes. Here is a brief brush up. We all know majority. We are experts in this. What is dyslipidemia? What are the clinical conditions it comes? So, what is dyslipidemia? It is nothing but dyslipidemia. That is derangement, or it may be raised, or it may be there is deficient in the lipoprotein metabolism levels. Lipoprotein levels because of altered metabolism. Understood? This is not a disease, it is a clinical condition. Always remember, this is not a disease, it is a clinical condition only. Further, if this stage is continued, it is going to cause the disease or any other disorders. So group of clusters of diseases, comes in this dyslipidemia. And nowadays dyslipidemia we are not using the word, this is the very older word. Probably 7 to 8 years ago we are using the word dyslipidemia. Nowadays we are using in particular words like hypercholesterolemia, hypertriglyceridemia, and moreover in the advancement we are using the apolipoproteinemia, where we are directly targeting the apolipoproteins and we are going depth into each of that for the line of treatment. So dyslipidemia is the very old word. Still, this is for the basic understanding I have used the same word here. So the question comes, what is it? How it is measured? What are the risks for this? The common questions which turns over our head day to day when we are sitting in the clinic practice. Understood? So I explained what it is. it is the derangement in the metabolism of lipoproteins. Clear? How it is measured, on what basis we are going to measure this? See, based on the raised lipoproteins, we are going to call this in the different names, either as a hypercholesterolemia, hyperlipidemia, hypertriglyceridemia, as I said, hypolipoproteinemia, or hyperapolipoproteinemia, like this. So it is measured basically when a patient come to us, we are going to measure this with the basic lipid profile. Understand? When the patient clinic, in the OPD settings, if the patient comes, we don't write for the go for apoprotein B testing or go for genetic testing. We don't go with this. We go with the basic lipid profile. That is nothing but the lipid profile components, along with these components there is the ratio of HDL LDL, and there is total cholesterol with the HDL ratio, which give us a basic idea what is increased and how we need to tackle. Now, as the days are advanced, we are concentrating more on the non-HDLC, which gives us a risk estimation, because in the physiology we know about the there is cholesterol transport, reverse cholesterol transport. This cholesterol transport, whenever the degradation occurs, the cholesterol degraded into LDLC, then it will be the final degradation, VLDLC. So the non-cholesterol HDL gives us the risk estimation at which stage the pathology is there. So it helps us to
ಅವರಿಗೆ
give proper
ಸಮಾಧಾನ
treatment.
ಅನ್ನೋದು ಒಂದೇ ಬೆನಿಫಿಟ್ ಅನ್ಸುತ್ತೆ. ಅವ್ರಿಗಾಗ ಬೆನಿಫಿಟ್ ಕಮ್ಮಿನೇ. ಪಾಪ ಅವ್ರೆಲ್ರಿಗೋಸ್ಕರ ಅಂತಾನೆ ಮಾಡೋದು.
Excuse me, can you mute the
Sorry,
mic?
ma'am. Yeah, it's muted, ma'am. Please continue.
Thank you. Okay. Then you can see here what are the other markers here. Lipoproteinemia, then genetic testing. These are the high levels and the later stages. If doesn't come down with the medicines, we go with this. But commonly we don't go with any of this. We'll just go with the basic lipid profile. Then about the non-HDLC. Clear? Yes. What are the risk we can see? Risk, the first and foremost, definitely it is inherited genes. So we should be always careful with our family things. Then, as we said in the introductory part itself, it is about the sedentary lifestyle, mainly about the food and our physical activities. Next is about the age. Whenever there is advancement in the age, we go produce more of the cholesterol levels, older and older levels. So we should keep monitoring about this. Clear? Yes. Next, how do I look? How do I look means how can we see for the clinical symptoms or features? So whenever the patient comes, you just think about your clinic practice. If a patient comes, nobody says I have increased cholesterol levels, increased lipid levels. People come until unless if they don't go for the master health checkup. So if the when more learned people, as they consider Google as the doctor itself, they'll say I have increased cholesterol levels. Apart from this, none of the people common people, they'll come to us with simple symptoms. ಸುಸ್ತಾಗ್ತಿದೆ, or they say giddiness, or ತಲೆ ಸುತ್ತಿದೆ, ಇತ್ತೀಚೆಗೆ ಹೆಚ್ಚಿಗೆ ಕೆಲಸ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗಲ್ಲ, ಇತ್ತೀಚೆಗೆ ಹೆಚ್ಚಿಗೆ ಕೆಲಸ ಮಾಡಕ್ ಆಗೋದಿಲ್ಲ, ಕೈ ಕಾಲ್ ನೋವಿದೆ. They are going to say these types of clinical conditions. Okay, this I'll explain how to understand, as it is a clinical condition, how to understand the clinical features, which is beautifully explained in our Ayurveda. Okay, how it looks, there are multiple clusters, multitude symptoms are there, that we'll discuss later. Yeah, how do I manage? When we go for this, the first and foremost things comes is about the lifestyle modification. Okay, as it is a metabolic disorder, and the first and foremost stage of the metabolic syndrome, we are supposed to go and consider for the lifestyle modification. Another thing, very important thing, when the patient comes to you, they say I am taking rosuvastatin. Okay, we should always remember Though statin is the first line of treatment, it is not the only medicine we are supposed to give. It is not the default medicine which we are supposed to give whenever there is increase in the lipid levels. Always remember this. Statins are given only when there is increase in the cholesterol levels. Understood? Whenever there is increase in the cholesterol levels, we are going with the statin levels. If it is there is increase in the triglyceride levels, definitely we are supposed to give the first line of treatment is about the fibrates. Understood? If there is combination of increased triglyceride and cholesterol levels, we are supposed to go for the niacin analogs. This is how they have divided the line of treatment. And similarly, in our classics also beautifully explained the concept of management of dyslipidemia that we'll discuss further. Yes, now comes to our heart of the study, that is concept of dyslipidemia in Ayurveda. Yes. May I know anybody what we can consider dyslipidemia in Ayurveda, or how the clinical symptoms, what you have seen in your clinics? If anyone is interested, please share your views such that we can go further. Anyone? Okay, I'll continue then. Yes. See, the dyslipidemia in Ayurveda, as I said, it's a clinical condition. We give different names. That is Sharira Anukrama Atisneha. Yeah, Santarpanotta Medhavriddhi. Yes, Santarpanotta Medhavriddhi, right? Then no, my thinking is I want to, being a clinician, I want to share my views in terms of clinical experience, or what we can see practically and how we need to tackle that, rather than go for more of theory. That's why I want it to be an interactive session. If you are interested, such that we can learn more. Yes, Taulya, Kapha Medo Vikara, right? Yeah, the theoretical parts all are very nice. How about in clinical aspect? What you have seen in your clinics? Any one patient experience? Anybody regarding patient experiences? Yeah, please think about this till the end of the session. Let us go with the clinical discussion at the end. That will help all of us to learn more. Okay. Yes. Understand the concept. Sharira Anukrama Atisneha, Raktagata Sneha, Medodosha, Kafamedavrutavata, Shonita Abhishyanda. Okay, these are the different terminologies what we have given for the dyslipidemia. But always remember, the dyslipidemia I do consider in terms of the Sharira Anukrama Atisneha. This is the word mentioned by Sushruta, mentioned in Sushruta Samhita, Sutra Sthana, 15th chapter, 32nd shloka, which is exclusively explained. It rule out by, yeah, I will discuss at the last. Is Sushruta explains the cluster of metabolic syndrome, or the complete metabolic syndrome, in one complete shloka, including everything beautifully, rather than our contemporary science in the olden days itself, which has given us very beautiful understanding about the dyslipidemia. Let us go with that. See, this is the reference from Sushruta Sutra, 15th chapter, 32nd shloka, where Acharyas explained about the metabolic syndrome in Ayurveda. Clear. This is the base for all our metabolic syndrome disorders or clinical conditions. I do go with this. Rasanimitameva staulyam karshyam cha. Rasa nimittameva. Rasa nimittam means here we are supposed to consider ahara rasa. Understood? Ahara rasa, rasa nimittam eva. All this metabolic syndrome is because of the ahara rasa. Any derangements in the metabolism or in the physiology. Clear? The same thing is explained in our modern physiology also. So, rasa nimittameva, both staulya and karsha. Okay, that is the cluster of metabolic syndrome. Then he explains about the nidanas, that is tatra shleshmala ahara sevino adhyashana shilino avyayamino diva swapna ratasya. See, here clearly explained four nidanas. One is shleshmala ahara sevana, then adhyashana, avyayama, and divaswapna. These four, what we say for the sedentary lifestyle or modern lifestyle, including stress, all these things is explained in the base principle of only these four. Clear? So further, with this nidanas, what happens? Ama eva annarasa maduratarascha. What happens? There is a formation of ama, and because of these nidanas, the annarasa become maduratara. How it become maduratara? We'll discuss in the samprapti of the dyslipidemia. So what happens when ama mixes with the madurataranna? There is increase in the snehamsha and it moves through the circulation. That is what called shariram anukraman ati snehan. Understood? This is the clinical stage of we call as dyslipidemia. Sharira anukraman ati snehan. Okay, that is initially it will move through the circulation. That moving of that medas or sneha in the circulation, that stage is called as dyslipidemia in Ayurveda. That's why we gave the coin term Sharira Anukrama Ati Sneha. Okay. Further, if it is continued, it will causes Medho Janayati. Medho Janayati, that is, it is going to formation of the adipose tissue, immobilized adipose tissue. So, the next stage is called as Atistaulyam Apadayati. Next stage is the Staulya. Once the staulya occurs, what happens? The lakshanas you can see Kshudra Shwasa, Pipasa, Kshud Swapna Sweda Ghatra, Kratana, all these things it is mentioned. So, in this stage also, if you are not going to treat the line, then it causes Kapha Medo Niruddha Margatvat, all these things. That is Rasato Shukra, it is going to hamper. Then in the further stages, if you have not treated, it leads to further complications like prameha pidaka, jwara, bagandari, vidradi, all this vata vikaranam. That's why vata vikaranam, remember this word because this is very important when we are going to discuss about the lakshanas. See, the further stages, prameha pidaka, jwara, bagandara, vidradi, vata vikara. Vata vikaras we can consider in any terms of stroke, all these things. That's why I said remember this. Right? Yes. And here another thing you need to understand is na shesha dhatavo apyayanartham, means the further dhatus will not be nourished other than medas. That's why there will be lakshanas, not only about the medas, other lakshanas will also be present. Clear? This is about the brief thing about the metabolic syndrome, what has explained in Ayurveda. Yes, coming back to our discussion. Yeah, why this coin term? That Shloka has clearly given us. So, Nidanas, Shleshmalahara Sevana, Adhyashana, Avyayama, Divasapna, and then as it is explained in the Charaka Samhita, the Santarpanotta Nidanas, you can go through that in Charaka Sutra, 23rd chapter. Then another very important thing is about the Gramya Doshas. The Gramya Doshas, it is mentioned in the Charaka Chikitsa, third chapter, Charaka Chikitsa, first chapter, where before explaining about the Rasayanas, whatever the Nidhanas, Lakshanas they have mentioned, those are also cause for the clinical condition like dyslipidemia, where they have highlighted about the Navanna, Viruddhanna, all these things, and Vishyandana, all these things are mentioned. You can go through that. See, This is about the nidanas. Before going for the lakshanas, we need to know about the what are the derangement occurred in the physiology aspect. Why that lakshanas occurs? Because I said dyslipidemia is a clinical condition which is presented with the different types of clinical presentations. Okay, it is not the patient comes to us with saying ನನಗೆ ಕೊಲೆಸ್ಟ್ರಾಲ್ ಜಾಸ್ತಿ ಆಗಿದೆ, ಲಿಪಿಡ್ ಲೆವೆಲ್ ಜಾಸ್ತಿ ಆಗಿದೆ, ಯಾರೂ ಬರೋದಿಲ್ಲ. ದೇ ಕಮ್ ವಿತ್ ದಿ ಕ್ಲಿನಿಕಲ್ ಸರ್ಟನ್ ಥಿಂಗ್ಸ್ ವೇರ್ ವಿ ನೀಡ್ ಟು suspect or we need to think maybe there is increase in the lipid levels. Okay, so before to know that clinical features we need to understand this, the basic ahara pachana krama. Yes, we know about that ahara pachana krama. That is, there are mainly two things occurs with the ahara pachana krama, that is poshaka rasa and poshya rasa. Whereas in the poshaka rasa there is stula bhaga, sukshma bhaga and mala, production of mala. You know, the sukshma bhaga nourishes, stula bhaga forms, and mala it will be excreted. Meanwhile, the poshya rasa, whatever is there, it is explained in terms of the nyayas in ayurveda. That is kshiradadi nyaya, kedara kulya nyaya, kale kapota nyaya. Okay, apart we commonly know these three nyayas. Apart from this, there is another nyaya which is said in the Ashtanga Hridaya Sharirasthana 3rd chapter, that is nothing but the pratisroto nyaya. We don't give much importance to this. This is given in the commentary of the Ashtanga Hridaya Sharirasthana 3rd chapter. Okay, while explaining the nyayas, they said pratisroto nyaya. This nyaya will goes like, as we know, the nourishment starts from rasa to shukra. Rasa nourishes rakta. After the formation of rakta, it nourishes the mamsa, then to meda, then to asti, majja. Meanwhile, there is reverse nourishment. Reverse nourishment, that is from medas to mamsa, mamsa to rakta, rakta to rasa nourishment will occur. That is what called pratisroto nyaya. You can clearly observe here the nourishment start from here to here. Meanwhile, the nourishment starts from meda to mamsa, mamsa to rakta, rakta to rasa. Understood? This is the base concept of pratisroto nyaya. What happens in dyslipidemia is, because of the nidanas which causes medo vruddhi, the further as there is increase in the medas, the further dhatus will not be nourished. That is, asti, majja, shukra, apyayana will not occur. Okay, so what happens? As I said, dyslipidemia, it is derangement. There may be increase or the deficient. As asti, majja, shukra are not nourished, we are going to see the clinical features related to this asti, majja, shukra, all these things. Meanwhile, the further as medo ruddhi will be there, there is no nourishment for the mamsa, rakta and rasa. Hence, we are going to find the clinical features related to these dhatus also, rasa, rakta and mamsa. Clear? So in dyslipidemia clinical condition, we are going to see different clinical presentations of the different srotas. That's why in a cluster we can consider, or we have observed based on our observation, we grouped this under the cluster, the lakshanas, like this. We can find lakshanas among the features which mentioned in the Shleshma Nanatmaja Vyadis, that is in Charaka Sutra 20th chapter. Atisnigdha Lakshanas, again, it is in Charaka Sutra 13th chapter. Prakupita Kapha Karmani, the features which are explained in the Prakupita Kapha, that is in Charaka Sutra 20th chapter again. Then Annavrita Sneha Lakshanas, that is Sneha Basti Vyapat, Charaka Siddhi 4th chapter. So whatever the features which are explained in this cluster, that all we can see clinically. Okay, clinically we can see, we have observed in more than 100 patients. So majority of the patient will be having the lakshanas like what they have mentioned: gaurava, tandra, alasya, shula, and then klaibya, All these are mentioned. As I said, it in these four includes the lakshanas from rasa to shukra. Okay, there is no nourishment of any other dhatus other than medas. So we'll find the lakshanas, definitely clinical features, anything other than anything apart from the medas also. So whenever the patient comes to clinically, we have to think in another angle also. Maybe that is because of the increased lipid levels. Okay, and another thing I want to clear here is, whenever they are saying in the contemporary science, they said about the HDL, LDL separately, VLDL, all these things separately. They said about the clinical conditions, HDL, LDL, VLDL separately, and they are going to find lakshanas separately with this. Sorry for the interruption. See, Shleshmanatmaja Vyadis, as I said, in the modern terms, they said about the LDL increase, VLDL increase, cholesterol increase. Separately, they have given the component LDL, VLDL. But in Ayurveda, we consider dyslipidemia as atisneha or medovruddhi only. We consider that lipid itself as a medas. Okay, and we don't differentiate that separately as LDL, VLDL. Understood? But in our Ayurveda, we consider those lipid levels as a stages. Okay, stages of Kriya Kala that we'll discuss in Samprapti. Clear? The Lakshanas, as I mentioned here, you just open up the references what I have given, and just think about the patients who have came for your clinics. Maybe that might be because of increased lipid levels. So the comes under features Shleshmananatmaja Vyadi, Atisnigdha Lakshana, Prakupita Karmas, and Navrita Sneha Lakshanas. These all can be considered as the under the clinical features of dyslipidemia. Yes, here comes the long way how to understand the samprapti of the dyslipidemia in Ayurveda. Yeah, as I discussed in the previous slides, Ahara Pachana Krama, as it is the derangement of the physiology, we have to consider from that stage itself. Ahara Pachana Krama, during that, we know the mala of the rasa is kapha. That is malarupi kapha, we call that as. Okay, there are two things we know, that is Shleshma as a bala as well as Shleshma as a vikara. Here, mala, rasadhatu mala at the end of the ahara pachana is Shleshma. Okay, once this mala is kapha and the person indulges in the nidanas, as I said previously, Shleshmala ahara, viharas, santarpanotta nidhanas, gramya doshas, there will be, as the all these will increases the kapha, there will be impairment in the atma rupa of the kapha. We all know the atma rupas for each dosha. It is mentioned in Charaka Sutra 20th chapter. So the atma rupas of kapha like pichila, sneha guna, there is mainly increase in the pichila guna and sneha guna of the kapha. Those are the atma rupas of kapha. This atma rupa, further taking of the nidanas, increases snehamsha, of snehamsha. So initially Kshipra Shleshma Prakopa. I said Kapha is the Malarupa and the Gunas increases. So the volume of Kapha increases in its sthana. So this can be considered as Sanchaya Avastha. Understood? In the dyslipidemia, Sanchaya Avastha, we can see there is Kshipra Shleshma Prakopa. Understood? If the nidanas are continued again, then it will leads to the because it will lead to the further increase in the same Atma Rupas, which are having similar guna to that of the Medas. Okay, as it is similar guna of the Medas, there is increase in the Medas. Especially we know Baddha and Abadha Medas. Initially, there will be Abadha Medas. The Abadhatva will be increased, and because of that Abadha Medas, we can find Sharira Shaitilya. Okay, this principle is because of the Samana Guna Bhuishta Samana Vruddhi. Okay, there is Samana Guna Vruddhi will occurs, and because of the similar Guna with the Medas, there is increase in the Abadhatva of the Medas, which is the terms of Sharira Shaitilya. This is the stage of Prakopavastha. Second Kriyakala Prakopavastha. So further, if the same is continued, that Abadha Medas will be carried through the circulation. Okay, as it is carried through the circulation, this stage is called as Prasara Avastha, and this word what we say is Meda Sahita Amaha. The circulation will carry the ama. Along with that, as the volume is increased of Medas, that increased Medas will also be carried through the circulation along with the ama. That's why this stage is called as Meda Sahita ama. And this stage is called as Prasaravastha. And further, we know about the Sthana Samshraya Avastha. So in that Sthana Samshraya Avastha, this Meda Sahita Ama will be in Nibida Avastha. Nibida Avastha means that will not be exposed, which is not Anutklishta Avastha. We call that stage as Anutklishta Avastha or Leena Avastha. That is expressed in the terms of Nibida Bhava. This you can see the same reference is from the Ashtanga Sangraha. Ashtanga chapter. Next shloka, they explained in the Tika Nibida Bhava as Leena Avastha or Anutklishta Shleshma Avastha. Okay, that stage we consider as dyslipidemia. So this is the clinical condition in between the stages of Kriya Kala before the Vekta Avastha, and it will be in the Leena Avastha and Anutklishta Avastha. Okay, that stage is called as dyslipidemia in Ayurveda. Further, if the nidanas are continued, definitely it will go to the further of the Vektavastha that we can see in Raktadi Dhatus. It continued as simple thing. The volume is increased, anything that will burst out. Similarly, whenever the volume of the lipid is increased, it will be carried to the other dhatus. So that's why it will cause flabbiness, or it will increases the it will loosens the other dhatus, where we can find the stability is decreased, where we can find looseness as flabbiness. That is what we call shlatikarana of rakta adi dhatus. Understood? This is the Vektavastha. So in the Vektavastha, further it causes, as the volume is increased, it goes on coating to the layers of the vessels, vascular layer, what we call tunica layers, in the substantia or in the mucosa, submucosa level, the tunica levels, that all go on coating with, because of this increased lipid levels. That stage is called as Upalepana Avastha. Understood? Further, if the nidhanas are continued, it causes the coating, what we call in the modern terms as sclerotic changes, plaques. The same thing is explained in our science as Damani Upalepa, Damani Pratichaya, Kanta Upalepa. This is what occurs in the dyslipidemia further stages. Understood? This is why the same thing explained in the modern, 1/3 of the attributing factor is dyslipidemia for cardiac disorders. This is the samprapti, what happens exactly, which is beautifully explained here by our acharyas. Clear? Yes, upalepana, and another thing whenever the upalepana occurs in the srotas, or what we call in the vascular level or the vessels, whenever the coating occurs, definitely the pressure of the circulation increases. When the pressure of the circulation increases, it exhibits in terms of the hypertension, increased blood pressure. That is what the stage called hypertension. Whenever the patient initially comes to it which there is increased blood sugar levels, we should think of this also. Maybe the hypertension is secondary to dyslipidemia. Maybe there is already a stage where it crosses dyslipidemia, and there may be already the coating occur. So it's better to go for the investigations which are helping us to prevent the further complications. Okay, this is giving us a clear idea what might have occurred, what might will occur, all these things. Okay, this is about the samprapti of the dyslipidemia in Ayurveda. The references for this is a combined thing what we have made. The reference is from the all the references what we have taken for is one is about the Charaka chapter, and then Charaka Sutra 24th chapter, and then Sushruta Sutra 15th chapter, then about the Ashtanga Hridaya Sharira 3rd chapter, Ashtanga Sangraha Sutrasthana 24th chapter. Clear? The combining all these things, we have made this Samprapti. Yes, we know the modern thing about how the pathogenesis occurs, where in the end we can see here there is increase in the catabolism of HDL. So there will be decrease in the levels of HDLs, increase in the anabolism of LDL and VLDL, which are the final degradation of the cholesterol. So there is increase in the levels of these because of the etiological factors you can see here. Yes. Now comes to the important aspect, how to tackle this dyslipidemia, because the word very easy to say, dyslipidemia, medoroga. How to tackle this? Because in the Samprapti I showed you about different stages. There is Chaya Avastha, Rakopa Avastha, Prasara Avastha, which is a crucial period, the Prasara Avastha, because that will be in Anutklishta Avastha. How to tackle that? Which line of treatment we can give in which stage? That is very important. See, here in the Chikitsa Upakrama, the first one what I mentioned is Rasadi Dhatunam Apyayananam. That means, first and foremost, considering the physiology, we are supposed to concentrate, or we are supposed to focus how to improve the circulation, how to improve this, how to nourish this dhatus or tissues, how to bring back the physiology or mechanism or metabolism normally. Okay, that is possible with the ahara and vihara, what lifestyle modifications what they explain, the same thing we can follow here. That is what the first and foremost thing we are supposed to do. We should explain the patient, or we should say the patient, please change your routine, whatever that is that has changed. Understood that? Next, in the Charaka Sutra 21st chapter, what they have mentioned is Vatagna Annapanani Shleshma Medoharani Ruksha Ushna Basti Tikshna Basti Rukshnani Udvartanani Cha. See, here we can see the baseline is Shleshma Medohara Dravyas we are supposed to use. Meanwhile, because of the physiology, there is involvement of the Vyana Vata and Samana Vata. Definitely, we are supposed to concentrate on Vata dosha as well as Pitta dosha. That's why they mentioned even Vatagna Annapanani also. Okay, but whenever we are going to treat this dyslipidemia, we are supposed to concentrate on Ruksha Ushna lines of treatment itself. Especially Rukshana is the best prime line of treatment in case of Chikitsa. Yes, the same in the Sushruta. He has clearly, very practically mentioned. You can see here. Ataha tasya utpanna hetur pariharet. Utpanna hetu, what is the causative factor? The 4 causative factor, what he has said, you have to tackle that first. Then only it can be cleared. Apart from this, what else we can give? He said, Shilajatu, Guggulu, Gomutra, Trifala, Loharaja, Rasanjana, Madhu, Yava, Mudga, Horadushaka, Shamaka, Uddalakadinam. Okay, you can see here there is a cluster or the mixture of the shamanas as well as ahara things also, madhu, yava, then mudga, kora, dushaka. All these are the ahara padarthas what we are consuming daily. That also you can use. The baseline comes here. What Sushruta says is virukshaniya chedaniyanam cha dravyam. See, virukshaniya and chedaniya are the base principles we are supposed to use in case of dyslipidemia. And another thing what he mentioned directly is vyayama. Of course, vyayama is exclusively we need to advise them considering their bala. Then basti, which is having the prime role in the dyslipidemia, that is very clearly mentioned which basti is lekana basti. Why the important rather than vamana virechana we give more importance to basti here is, as I explained previously, nibida bhava, that is anutklishta avastha. It is in leena dosha avastha or anutklishta avastha. So to take out from that, definitely vamana virechana help us to take out the utklishta doshas only. Okay, we do sneha pana, we do vishramakala, and we do utklesha, and utklishta doshas only will be taken out. But basti anutklishta doshas also it will take out. That's why we say basti as the best line of treatment, or sampurna or ardha chikitsa, and the first foremost stands when considering panchakarma. Okay, so here basti, what happens, the action is because of the virya, that is not in relation to the agni. That's why because of the virya present in the lekana basti, that is ushna tikshna dravyas only we are going to use in the lekana basti, that will carry to the srotas, or the virya will be carried to the metabolism completely, and it is going to clear that leena avastha itself. It is going to clear the shleshma which is present in the leena avastha. That's why they directly mentioned about the lekana basti. Okay, this also you can follow. Another thing, virukshaniya chedaniya dravyas, there are two aspects he mentioned, virukshana dravyas and chedana dravyas. What do you mean by virukshana? What do you mean by chedana? How to imply that? Which stage of dyslipidemia or which stage of metabolic syndrome we need to apply this? That is very important for us to know. See here, what they mentioned is, see, we know Medo Pradoshaja Vikaras, Medo Dushti Lakshanas, where they have mentioned about the Ashtaninditiya Lakshanas like Staulya. Then another thing what we saw is Prameha Purva Rupa. Okay, this is mentioned in the Charaka Sushruta Sutra 15th chapter, the shloka which I discussed, Rasanimitameva Staulyam Karsham. So the stage where if there is Ama Eva Annarasa Madura Tarascha, whenever there is Ama Eva Annarasa Madura Tarascha, we have to go for the blood sugar evaluation. Okay, if that is initial stage blood sugar evaluation, where we can found bahu drava shleshma and bahu abadda medas. Understood? This is the blood sugar evaluation where we can see the findings about bahu drava shleshma and bahu abadda medas. So this stage, if you are going to find this, there you are supposed to go for virukshaniya line of treatment. Virukshana means in that Dalana, he mentioned in the commentary as shoshaniya dravyas. Okay, shoshaniya dravyas like shilajatu, guggulu, gomutra, you can give. Another thing, there is another stage. Sharira, this is the first stage. Blood sugar evaluation we do. The next stage of this, what I explained previously, Sharira Anukrama Atisneha. If that stage is there, we are supposed to go for the lipid evaluation rather than blood sugar evaluation, where we can find lakshanas related to upalepana. Okay, whenever there is upalepana is there, definitely we need to scrape it out. That's why in the classics they mentioned if that stage is there, we are supposed to go with the chedaniya line of treatment. Chedaniya means Dallana mentions as sroto vishodaniya. That means which is take out, flush out. There we go with the lekana basti, and go with the haritaki, all these things, even gomutra, tiksha dravyas. Okay, so whenever there is ama eva annarasa maduratara stage, virukshaniya line of treatment, we are supposed to go. And whenever there is Upalepana stage or Atisneha, Sharira Anukrama Atisneha stage, we are supposed to go with the Chedaniya or Chedaniya line of treatment. Okay, this is how we are supposed to select the line of treatment in case of metabolic syndrome as well as dyslipidemia in Ayurveda. Yes, these are some of the yogas which is mentioned in the classical texts. Especially this is compiled from the Charaka Rasayana Adhyayas. Beautifully they have given in the commentaries as well as in the shlokas. The first thing is about the Haritaki Yoga. Haritaki Yoga, see, I'll give you an example, clinical example. If the patient comes to you, probably aged about more than 70 years, or maybe they're not willing for the Panchakarma or Shodhana line of treatment, give Haritaki Churna as a Anulomana for 3 months. It is going to help you to clear the lipid levels. This clinically I have observed personally with the patient. That's why I'm sharing here. See what they have given: Sroto Vibandhan Vividhan Pralepan Hrudayo Rasoho. See the reference, the solid base is there for us to practice. Sroto Vibandhan Vividhan Lepan. It is going to clear the lepa, upalepas. Maybe it may take longer time, but it is going to clear. So this I have practically seen in many patients giving Haritaki Churna long term as an Anulomana. It has given us very good results. Similarly, you can see Ballataka Rasayana. I am not practicing this. Then Shilajatu Rasayana we are practicing. Then Shilajatu Yoga we are practicing, not as a Rasayana. Okay, and I want to highlight here another thing is Lashuna Kalpa. Lashuna Kalpa is giving very good results. Pitta Rakta Vinirmukto Samastaha Avarana Avrute. Okay, here we are going to see Kafa Meda Avarana. Okay, Kafa Meda Avarana will be there. So here Lashuna Kalpa will be more helpful for us to clear the features. Like that, Gugulu Kalpa. We know Gugulu, it helps in the Sroto Shodhana, Trioshana Yoga, Palandu Rasa. Palandu Rasa also helpful in making the clearing the features. Nirvalatva of the Raktadi Dhatus. Then Patola Nimba Yoga, that is Taulyahara, that might be helpful for in some of the Lakshanas. Then another thing is here you can see Abraka Kalpa. Okay, whenever there is, see here, whenever there is Sama Avastha, that is initial stage, go with the Abraka Kalpa, that is more helpful. And Tuvaraka Rasayana, Sarvan Dhatun Vishodayaha. Tuvaraka Rasayana, you have to be use Balataka and Tuvaraka carefully. So they have given Sarvan Dhatun Vishodayan. And another very important thing I want to highlight here is Shivagutika. Okay, Shivagutika. See what they have mentioned: Agni Moolam Eva Labham. Agni Moolam Eva Labham means it is going to help clearing that. Obviously, when it comes to the physiology, it is about Agni only. Okay, it is helpful in maintaining that. Then it can be then another thing what practically we have used is yava yogas we can practice. Another one is about the, as it related to the metabolism, the fat metabolism occurs in the liver. So here to tackle that, we are supposed to go with the Bedaniya line of treatment. Shamana yogas, Bedaniya dravyas we should give. So the Bedaniya dravyas, like the most famous one what we all are practicing is Arogyavardhini Rasa. Okay, the prime content is Katuki, which is a Bedaniya. Arogyavardhini Rasa we can use. And another one in Charaka Sutra 3rd chapter, where he has mentioned about 32 Yavagus. There you can see some of the yogas they mentioned Kafa Medohara. One among that what we practice is Dashamula Sadhita Yavagu. Okay, Dashamula Sadhita Yavagu, that is also going to be more beneficial. That has helped us in the patients also. Okay, that is one thing what we have practiced. Of course, Shivagutika we are using that. Then practically we are using Meha Abhaya Kashaya also. Previously it was Asanadi Kwata. Asanadi Kwata is beneficial. That patent or the pharmacy, it is available nowadays as Meha Abhaya Kashaya. That is also giving good results. And I want to give another input here. why they have given more importance to rukshana in dyslipidemia or rukshana in medo vikaras. See, this is the reference from Charaka Chikitsa 29th chapter. What they have mentioned is kupite marga samrodhan medaso va kafasya va ativruddha anile na adau shastam snehana brahmanam. Understood? Kupite marga samrodha occurs because of the kapha and medas, and there is ativruddha vata. We are supposed to go with the rukshana line of treatment. Na adau shastam, initially we are not supposed to go with the snehana and brumana. So we are supposed to go with rukshana line of treatment itself. That's why in the metabolic disorder, the first and foremost line what we practice is rukshana. Which all rukshanas what we can give here, he has given in the next lines. Vyayama, shodhana, arishtapanas based on depending upon the causative factor, whether it is mamsaja nidana, medhoja nidana, rasaja nidanas, we are supposed to go with the select the type of arishta. Okay, usually vidanga arishta we usually practice, and even abhaya arishta we can use. Like the abhaya arishta, then vidanga arishta, as I said, the nidanas like mamsaja or medoja, whichever is the prime nidana that we can practice. Then takra abhaya prayoga ischa. Takra prayoga, that is exclusively in practice in the form of takradara as well as takrapana, which is the best rukshana. Then abhaya prayoga, I said haritaki yoga. Why it is? In the previous it has given that sroto vibandhan upalepan nirharet. Another thing, shapayen kapha medasi. All these things will help to reduce the kapha and medas. Okay, further he has given the bodhi ruksha kashaya. Those are also we can use. And in the last line, shilajatu prayoga, guggulu, makshika, these are also mentioned here. The same reference, it is mentioned in Charaka Chikitsa first chapter with why it is, and the reason also I gave you. And another thing, see, where we are supposed to go with the rukshana again before shodhana. See, mamsala, medhura, buri, shleshma, vishamagnayascha. These are the four conditions: mamsala, medhura, buri, shleshma, and vishamagni. To avoid vyapat during snehapana, we are supposed to go with the rukshana initially. That's why in the metabolic disorders, especially in the type 2 DM or obesity or what dyslipidemia conditions or hypertension conditions, definitely we are supposed to go with the rukshana initially as a vishesha purva karma before going for any type of shodhana. Okay, this is one reference I want to give you, because whenever we are practicing panchakarma, there are two aspects, vishesha purva, vishesha and samanya. So in some of the cases, definitely we need to go for the vishesha purva karma, pradhana or paschat karmas. This is one concept related to metabolic disorders where we are supposed to go for the rukshana. Right? Yes. Yeah. Coming to conclusion, in the present era, due to lifestyle modifications like alteration in food habits, lack of physical activity, increased stress level, people are more in towards metabolic disorders, not towards already there. Hence, understanding the stages, which is very exclusively or elaborately explained in our texts, appropriately managing the strategies, we can help in primary prevention as well as a curative thing of the metabolic disorders, and we can reduce the burden on the further diseases like cardiovascular events. Yes, thank you one and all.
Thank you so much, ma'am, for that highly informative and enlightening session. With your permission, now we'll open the floor for discussion.
Sure, ma'am,
If
sure.
anyone has any questions, please unmute yourself or type in the chat box.
Another thing I want to say, when clinically patient comes to us, they say what I have seen is the patient comes to us, especially the pain, the bone pain. They say ankle pain is there, leg pains are there since many days. When we were thinking why this pain is there, we suspected about maybe lipid values variations. So when we go for the lipid value changes, when we go for the investigation, we found there was a change in LDL levels and cholesterol levels. We gave treatment for that. Lekanabasti itself we had given. So when we gave that, automatically whatever the clinical presentation was there, it was disappeared. Okay, and moreover, as we are practicing Basti, one thing is that is Utkleshana, as it is in Anutklishta Avastha, definitely we need to go for Utkleshana Basti before giving Lekana. So, such that the doshas will come out, or it will come to the Anutklishta to Utklishta Avastha, and we can take an out. Maybe when we are doing Vamana Virechana for the patient, there may be relapse of the condition or relapse of the clinical features. But when we are going with the Basti, definitely the patient will be feeling better, or it will be maintained for longer duration, more than 3 to 5 years. That depends on patient how they will be maintaining in further days. Definitely, Basti is having higher upper hand in case of these metabolic disorders when compared to Vamana and Virechana. Probably this will help for us to go for clinical practice. And some of the patient will come, they have giddiness, and they will have only tiredness, and they'll have disinterest in any of the works, all these things. When there is high LDL triglyceride, sorry, that does not pop up. 1 second.
When there is high LDL and triglycerides, what will be the best medicine?
When there is high, that's what I said. In our classics we don't differ that, or we don't say it as specifically IDL or LDL triglyceride levels. Triglyceride metabolism is totally different from that the metabolism of cholesterol. So all these together we call as atisneha. That's what I mentioned in the Samprapti. Whether it is in Chaya Avastha, Prakopa Avastha, or Vekta Avastha, we need to select there whether to go for Virukshaniya line of treatment or Chedaniya line of treatment. Okay, if there is already clinical symptoms are present, go for Chedaniya. If there is only what I said, there is pain or very minimal symptoms, just go with the Virukshaniya line of treatment, you'll get the better results. Yeah, what is the status of Medo Dhatvagni? Initially, we go with in this Ama Eva Annarasa Madhuratarascha. Definitely, Medo Dhatvagni Mandya will be there. Okay, initially, remember when the stage of dyslipidemia is there, Medo Dhatvagni Mandya will be there. Meanwhile, whenever it reaches the stage of the Staulya, there is Avarana, because of the Avarana of the Vata, there will be there is an increase in Agni, especially Jatar Agni. Definitely, there will be increase in Dhatvagni at that stage. This reference you can take what happens regarding to this Agni is from Charaka Chikitsa Grahani Adhyaya, where he has mentioned specifically Vata, Pitta, Kafaja. You have to adopt that, or you have to consider that whenever you are thinking about Agni in case of Medo Vikaras. You have to adopt that to the Samprapti, what it is mentioned in Charaka Sutra. Should we perform Snehapana for dosha utkleshana in Lekanavasti? No. Here, whenever we are doing this Snehapana, remember that in Vamana Virechana, the contact with Agni is more. Okay, that is in contact with Agni, we are going to treat the disease, but not in terms of the Basti. Basti, the relation to the Agni, especially Jatar Agni, it will not be there. So, the Anutklishta Avastha is in Srotas, not in relation to the Jatar Agni or that side. So, I think it's not about I think. Definitely no. Definitely no for Snehapana in case of Basti. Okay, it's definitely about the you are supposed to go for the Utkleshana in terms of Basti itself, where Sushruta has mentioned in Sushruta Chikitsa 37th chapter about Utkleshana Basti, Doshahara Basti, and Chamana Basti. Okay. Ma'am, is treatment protocol same for Vataja, Pittaja, Prakriti person? Yeah, see, Vata, Pittaja, Prakriti persons, Pittaja, Prakriti persons, definitely you need to take special care here. comes to you, rather the vataja, definitely it will be related to the pain related symptoms, majority of the patient kapha vataja. In case of pittaja prakriti persons, it is related to the metabolism, liver metabolism they say, and there is hampering in the metabolism. So you should be, I think, in pittaja prakriti persons, initially we should go for the virechana, then we can go for the basti. That will would be the better. In case of vataja, directly you can go with the basti. But if there is Meda Dhatu Agni Kshaya, I did not say Meda Dhatu Agni Kshaya. Kshaya is different from the Mandya. Understood? Because of whenever there is Agni Mandya is there, then only there will be a deposition of Medas, right? If there is proper Agni, it is going to be what is catabolized, and it will be it will become Malarupa, Stula and Sukshma, and it will be carried to further, right? There is no Kshaya or Ruddhi. Always remember, there is, in these conditions, always there will be Prakopa or Mandya. Ruddhikshaya, it is physiological. That is because of there may be changes in the body itself. These things because of our mistakes. So it is always Mandya or Prakop. Can we go with Stula Pramehi Chikitsa in dyslipidemia? Yes. Stula Pramehi Chikitsa, that's what I mentioned here. Stula Pramehi, Prameha, in Stula Pramehi is the next stage of the dyslipidemia. Whatever that Nibida Bhava Avastha is there, next stage Vekta Avastha. Before that, we call Prameha Pidaka Bagandhara Vilakkar. That is the stage of Prameha. So, definitely you can go follow the line of treatment what mentioned for dyslipidemia for Stula Pramehi. Okay. And if the prameha, the symptoms are more, go with Vamana first. Because whenever we are saying, I said there is Vishesha Purva Karma, Vishesha Paschat Karma. In some of the cases like this, we call this stage as diabetic dyslipidemia. This condition we call as diabetic dyslipidemia, where we need to go for the Vishesha Purva Karma, Vamana prior to Basti. Okay. Yes, definitely what mentioned in Astula Pramehi Chikitsa Pragada Vamanaihi Virechanaihi Snana Jalavaseka Vyayama, we can follow the same thing, and meanwhile Basti we can follow. The symptoms, I said it is unpredictable. Okay, unpredictable. That's why I mentioned there you have to go for the blood sugar level evaluation as well as lipid evaluation. That is where we can think this is the stage of Madhura Eva Annarasa, Madhura Tarascha. Okay, we unpredictable, as I said, different clinical symptoms the patient will come. Sometimes the patient will come without any symptoms also. Simply if you go for a general health checkup, they'll come. If you go for master health checkup, there is very much rise, more than 300 or 400 cholesterol levels or triglyceride levels. They will be asymptomatic. So based on the lipid evaluation, we can analyze, or we can anumana pramana, where we can think that this is the stage. Rationalize. That's it. Another thing I want to say here is, always remember, whenever you are going with the patient's evaluation of the lipid levels, hypertension levels, think about the Rutu. Okay, because whenever it is Sharad Rutu or Grishma Rutus, there is already Ushnata is there in the weather. Definitely Vilayana will be more. So if a normal person comes also, check with the lipid levels, it will be above 500 itself. That doesn't mean the patient is having the increased lipid levels. That is because of the weather condition. In Ayurveda, we know there are n number of factors we need to analyze. So this is one practical thing what I have seen. It's not only about the patient condition. Simply the patient will come with you with the investigation report. Seeing that, we should not make the patient to panic. Okay, we should make that patient to be calm first. We should analyze. If the patient come once checking BP 160 by 110, we say BP jasti ide, matre start madi. This is what the contemporary science is doing. No, we have to take what was the patient did in the last 1 week, past 1 week, and we have to evaluate the same blood pressure levels for morning, evening, or different timings in a calm time, and everything we know, you know better. then we have to come to a conclusion. Similarly, lipid levels also, we have to ask for the patient what they have taken the diet 1 week before or since 1 month prior to this going for evaluation. And always we say evaluation to be done 12 hours fasting. They might not have done that. Yesterday they have taken mite of non-veg and more, and they have given a sample. How come it will be a value will be corrected? So all there are many factors we have to analyze, especially in the Grishma Rutu and Sharad Rutu. Just observe with your patients, because of the influence of weather. Though they are asymptomatic, the values will be above 500 itself. Specific diet, I want to highlight this one thing. There was one patient who is an engineer whose sugar. He said what you asked, diabetic dyslipidemia patient. What he was following is, he's a South Canara person. He was going with the regular food since his childhood, but past 4 years, because of increase in his cholesterol levels or sugar levels, he started taking the quinoine, which is a Mediterranean food. Okay. When I was going to take the history of the patient, I asked what is his food habits, what he is going to do. He said, I am started with the quinoine, I am taking this. Then I said him, stop this for 1 month, let's see. I said him, whatever you are satmia to since your childhood, just go with that same diet. Let it be increase in your blood sugar values. Let us manage with the medicines for few days. So he stopped quinoine. He stopped quinoine and started normal regular food. His values drastically changed. Before starting with the Panchakarma treatment itself, he was normal. Then we did Basti, Vamana and all. He was maintained. And he said, I was unable to take one piece of jackfruit, one piece of jamun also, that is jamun fruit. Then he said, I took 1 kg of jamun fruit today. That is what the importance of diet in these disorders. If the patient is satmia to the food articles since their childhood or since their growing time, that is the thing what we are supposed to advise them. Among them, whichever is having less intent to increase the lipid values, that is better to advise. I don't think we have to specify or we can generalize the diet for everyone in these metabolic disorders. And moreover, we know the importance of yava products, or the food articles which we can do with the yava, that is more better.
Any other questions, please?
Just a minute. Yes, whatever I discussed with you, all these people, all these things, this is the topic which I have taken for my PhD studies. The only thing why we took this PhD studies in Ayurveda, we have touched all the aspects like that obesity and hypertension, diabetes, all this, but we haven't touched any of us. Very less practice in Karnataka regarding the cardiovascular events. Okay, that is what in our mind we want to touch that area. So let us take the cardiac disorders, but as we are lacking clinical experience, we thought let us take a concept which is having more intent or which is a main risk factor for the cardiac events. So this is the topic which the main reason for taking for the PhD study. And moreover, majority of the cardiac patient comes to us, and we are more reluctant. What happens, maybe there may be some changes. If we go for panchakarma, there might something happen like that. But uh, we have done Vamana in case of cardiac events also. We have get the good results, but you have to be very careful, and you have to take some precautions also, definitely. With all those things, we have got good results, and so much of clinical experience we have got with this dyslipidemia. We thought only the lipid values, but it is not the lipid values. It is about the clinical features you have to see. Okay, so concentrate on that more. And I would like to thank our principal sir are my guide. Dr. Kiran M. Gaud sir, whatever I have shared with you, all these things, it's only because of his blessings and what he has taught me. I shared with you all. Okay, I always remember and I want to thank sir. And another person I want to thank is Dr. Anjanaya Murthy sir. Okay, Anjanaya Murthy sir, because the base what we are today is because of sir's teachings. So I would like to remember and thank both of them. Because of their blessings, what we are here. Sir, we went with Mrudu Vamana one thing, and it was a block case of posterior block, and the patient, the main reason was because of the dyslipidemia only. Okay, Mrudu Vamana we didn't take much risk, and precautions we did Rukshana properly till the appearance of Samyak Rukshana Lakshanas. Then only we conducted Vamana, and we didn't go for the Snehapana till Twaksnigdata. Another very important thing you need to think is, if you want to success in any of the disorders, if you are advising Vamana, please go with Lakshanas till you find Twaksnigdata. Just if the person from the Adhasteha Darshana, or if the patient passed stools, oily stools, that is the sign. No, that is not the sign where you are supposed to. You have to see in Snigda, Twaksnigdata. Then only you are supposed to stop the Snehapana and to post Vishramakala. Otherwise, whatever you do, Vamana, you don't get the good, you might get the Vamana results, but not the exclusive results with the Vamana. Okay, some disorders are there, as they said, that na atisnigdan vishodayet. Some of the conditions where na atisnigda. Na atisnigda means make sure it has not reached the vyapat level, but samyak snigdana should have happened. Okay, if some of the patients will be there where bala will be less and sugar levels are uncontrollable, in such conditions, just go with the adhasta sneha darshana. In rest of the condition, definitely you should go for Twaksnigdata for Vamana. Done, ma'am.
Yes, ma'am. Thank you all for your active participation and patient listening. On behalf of the organizing team, I express our heartfelt gratitude to Dr. Lolashri ma'am for taking out her time amongst her busy schedule